Welcome to LEAP. We tell the stories so far about 8 Aboriginal and Torres Strait Islander primary healthcare centres and their plans to improve healthcare for their mob. The dots laying over Darwin right now represent the first LEAP learning community. The blue dots are our research partners, support organisations including Aboriginal and Torres Strait Islander community-controlled health peak bodies, primary health networks and government agencies. And the yellow dots now, popping up, are our primary healthcare centres in WA, Queensland and NT, who volunteered to be part of LEAP. These organisations have important knowledge and resources to share and to support health centres with improvement efforts. We all came together in early 2018 to learn from each other and to plan LEAP together. We developed a shared set of principles and worked out what data to collect and how. This was our first LEAP learning community. We continue to meet monthly over video conference and come together annually, fostering an atmosphere where we are led by the health centres and we build on existing strengths and where co-learning thrives between partner agencies. To each of the 8 centres to yarn with staff about quality improvement processes in their service, what works well and what they could potentially do better. As these photos show, we were impressed with the beauty of country and the strong spirit of community in every place we visited. Overall, we yarned with 135 people, and 62% of those yarns were with Aboriginal and Torres Strait Islander people. And, we learned a whole heap about improvement and how improvement worked at their health service. We wrote up these yarns into improvement stories, and with these stories, we travelled back to the services to check in and make sure we had captured the stories right. Once we got them right, we got permission to share these yarns amongst the learning community who came together, this time in Darwin, to talk through how improvement story ideas could be implemented. While we were out yarning with Mob, we also collected some quotes that showed some common interrelated factors impacting on improvement efforts. The first one's cultural safety. So a lack of cultural safety means community may not want to use those services and Aboriginal and Torres Strait Islander staff may not feel confident or comfortable in their roles. Ideas from centres to improve cultural safety include educating staff about community history, language and culture, developing policies on cultural safety so it becomes embedded within the healthcare organisation. Quotes on community engagement showed that communities needed to be engaged and empowered to offer suggestions on how to improve primary healthcare from their perspective. This may mean being flexible in approach, taking services out to community rather than relying on community to come to the clinic, and working in better and other community organisations to coordinate health service delivery. Ideas from centres to improve include running health and culture camps, increasing home visits, getting involved in community events. Shared ownership and approach to quality improvement show that, all staff should be empowered to offer suggestions for improvement. Health staff often found the term continuous quality improvement as scary and associated with the accreditation process of testing and compliance. For some, CQI is done every day without being labelled or documented as such. Ideas for improvement included having CQI on the agenda of every meeting, improving documentation when trialling improvement strategies, and more staff education and training. Quotes on strengthening systems showed Mob had identified processes within the clinic that could be tweaked to improve quality of care and patient experience. Ideas for improvement included improving patient flow within the clinic, improving use of IT systems, taking control of referral processes and external clinics. Workforce was another large factor. With high staff turnover means relationships are difficult to build amongst staff and community. It creates additional burden for local community teaching and inducting new arrivals only to have them leave shortly after. Ideas for improvement included creating a flexible roster system to increase morale, increasing the number of Aboriginal and Torres Strait Islander workforce, building in planning and development opportunities for younger staff to step up into management and fixing up clinic facilities. The LEAP team continue to work from the knowledge of health centre staff and partners, working with them to build the evidence around key factors, enabling implementation of improvement ideas. Given workforce is such a big issue, impacting on the way primary healthcare is delivered, We are thinking ahead about how we can work with mob and stakeholders to strengthen PHC workforce, so people enjoy their job and stay for a longer time in their roles. Some ideas we've already heard include providing education and training in community to skill up local mob in becoming nurses, doctors, and health workers, because educating and training staff from outside community about culture and making it the right match when we recruit based on personal knowledge and skills and attitudes is important. We are drawing from the many implementation frameworks that have been developed in the healthcare setting to work out a process suited to the Aboriginal and Torres Strait Islander primary healthcare context. With our research partners, we look to apply this process when co-designing ideas with community and other stakeholders around improving workforce models. Recognising the diversity of Aboriginal and Torres Strait Islander communities, these ideas need to be locally developed. What works in one community may not work in another. While ideas might differ, the co-design and implementation process remains consistent, promoting community and stakeholder involvement and ensuring system factors work together to build a stable, happy and effective primary healthcare workforce. Thank you so much for listening. We will update this presentation as the learning community journeys along its PHC improvement path. Check back with us again in a few months and we'll update you on how ideas have worked out and provide more detail about those important factors needed for positive system change.